At present, current guidelines suggest that we should be at least 6 months of stable weight after the weight loss surgery before we should start looking at or considering surgery. I personally think that 6 months is the absolute minimum. Really, it should be up to a year because there can be some weight loss after that as well. And certainly, if you haven't gotten to your goal weight, then you've got time after that 6 months to do it. I think particularly for body contouring surgery, 6 months is not sort of necessarily the time that you should be looking at. It should be more of the weight goal that you're looking at. So it depends on patients. Everyone ages and loses weight in a slightly different way. Probably the most common areas are arms, breast, midsection or abdomen, lower back, and thighs. And so for any one of those areas or any one of those combination procedures, I would typically do or offer circumferential lower body lifts plus one other procedure. And then for a second round of surgery, we do the other two areas that you'd consider a problem. So I think part of doing more than one procedure is really a balance between patient safety and sort of the economics of having to do multiple procedures. And I think for me personally, without putting patient safety at risk, safely, certainly a circumferential body lift plus one other small procedure is reasonable. Part of that management with a patient to sleep is not only having a good protocol for how to manage important things like DVT prophylaxis, but it's also post-operative management as well. And educating patients about the need to stay mobile and the risks of things like DVTs and PEs, and having a very frank discussion about those risks. As long as we manage them well afterwards and intraoperatively, those risks decrease significantly. So the biggest challenge for patients, first is managing patient expectations. I think that's probably the biggest thing from an operative point of view. The biggest issue is trying to get enough that's going to give a good result. Getting the best result from that first operation is essential, and so getting your weight down to the lowest possible spot that we can is also very essential. So there's a few important parts to that. The first part is having a large weight loss. So a large weight loss is considered anything greater than about 10 to 15% of your current body weight. After that, as long as you're having symptoms from the results of that weight loss, so rashes under the skin or infections, pain on movement or inability to wear clothes properly, then those are the qualifying factors for what would be considered Medicare covered weight loss. If they're Medicare covered, that usually means that most health funds will cover that as well. And if you've got several areas of the body, which is very typical for a massive weight loss patient, they should generally be covered under those item numbers.